If you've ever seen a spine before, it's real important to understand, as we talk about this word subluxation, that the spine is segmented. There are 33 different segments in the spine. So you've got one segment, you've got a disc, then you've got another segment, just like that. And that's how your spine is made. And you've got flexibility at those joints. They move, they turn just very slightly. And with use, there are muscles attached to these vertebrae of your spine, and they get stuck sometimes. And in chiropractic, a subluxation is when one of those areas doesn't move the way it's supposed to. It gets stuck. And when that happens, we get a few problems. We're going to come back to those problems. In medicine, a subluxation is when something is completely dislocated. And when that occurs, that's a bigger problem. And that's an emergency, and that needs some serious care. So, of course, we had medical doctors many years ago who were told that chiropractors didn't know anything and they didn't understand what they were doing. And then, of course, they hear that a chiropractor treats a subluxation, and then they think, wow, this guy is really has no clue what he's talking about. And really, he did, but we had two different definitions, and people didn't understand that. So in chiropractic, subluxation is when things don't move the way they're supposed to. And when you have two vertebrae of the spine that are supposed to move like this every day regularly, and they're not doing that, then what you end up with is a buildup of fluid, because that movement in the body allows the body to pump fluid through it. But when you don't have that movement, you get a buildup of fluid, and that fluid has chemicals in it. And those chemicals irritate the nerves that come out of the spine and go out to the rest of the body. And that's why we call it subluxation and not just a joint problem. If it's just a joint problem, it would suggest that there's only a problem where it doesn't move. But it's a subluxation because we have nerves that come out of the spine and go to your liver and your heart and your lungs and to all these different body parts. And when that occurs, when those nerves come down, if there's a lack of movement, you could possibly influence the communication between the brain, down the spine, and out to those organs if there's a lack of movement. This is why it is so important to make sure that the spine is able to move. It's a very simple concept. If that spine is not able to move the way it's supposed to, you then get the buildup of fluids, you then influence what occurs, and then you could have, as a result of that, an organ that's not functioning as well as it could. So in chiropractic, that was the basis for coming in and treating a patient. It wasn't the basis of pain or any dislocation or anything like that. It was the presence of a lesion in which the vertebra of the spine didn't move, or in any other joint for that matter in the entire body. So it's a very simple concept, but we had two different points of view that were clashing many years ago, and that's why we ended up sort of not understanding each other. But the reality is, in medicine, a subluxation is that big dislocation, and that needs to be addressed medically. And in chiropractic, if there's not enough movement in the spine, that needs to be addressed too. That just kills you a lot more slowly than a frank dislocation would. So D.D. Palmer now discovered this in 1895, and in the year 1895, we knew very little about the body. I mean, we just recently, in the late 70s, maybe early 80s, figured out that the spine was capable of being a pain source. People up until that point thought certain portions of the spine didn't even generate pain. So, because we didn't have MRI studies and these special nerve studies and all these tests where we could look into the body. I mean, these are recent breakthroughs. We're talking about, readily available in the late 90s. So prior to that, we couldn't do those studies like we can do them now. So D.D. Palmer in 1895 now is talking about a concept where there could be interference along a nerve pathway between the brain and any organ in the body, and we don't have any of these pictures. It sounds a little bit, not too sensible because it's ahead of its time. And we all know that sometimes when people make discoveries that are ahead of their time, the general public sometimes has an issue with grasping that initially. So that is the concept that he presented at that time, and today we found out he was right. Today we know that the amount of pressure, if you just were to lay your hand on your eyeball, that amount of pressure applied to certain parts of the nerves that come out of your spine would disrupt function of those nerves, right? Today we know about a lot, not everything, but about the nerve pathways that travel out down the brain to the muscles and then to an organ that's associated with that. Today we know that. We didn't know these things way back then, and we didn't have any tests to verify. So it's very important to understand that chiropractic really was an idea that was light years ahead of the date of its discovery. Now we're going to go on, because that's a nice introduction to chiropractic, and we want to make sure we give some time to some of the other types of therapies. And we're going to talk briefly about herbal medicines, because herbal medicines, as the years went by in Eisenberg's study, herbal medicines became the #1 alternative therapy in the United States. It surpassed chiropractic. Chiropractic was the #1 alternative therapy, and herbal remedies did, because people can go and buy those themselves. Chiropractic is like the largest doctoral profession. It is well, it's not the largest, it's the third largest doctoral profession, but the largest drugless healing profession in the United States. So herbal remedies, though, surpassed it as a method of treatment, because people can go to the store and they can self-medicate and take these things all by themselves. And basically, if you name a condition, mainly non-emergency conditions, there's an herbal remedy that might be useful for it. Everything from parasites to headaches to pain to inflammation to rashes to acne, constipation, other types of digestive disorders, children's earaches, or middle ear infections, which we're going to talk about in later shows. All those types of problems, there are herbal remedies that may be helpful for them. Notice there's all these different choices of therapy. You can do chiropractic, you can do herbal medicine. None are 100%. Some are more effective. But based on our experience, when we get done with this show, we'll have you some other options. I mean, probably somewhere around 70% of the reason that people go to the doctor could be addressed naturally. And we're talking about mainly non-emergency types of things, because those are, well, the #1 reason for doctor visits is really wellness. It's not sickness. Some people go just to get an exam. But after that, we have a few other things that we're going to cover with regard to why people go in future shows. Now, there's all these varieties of herbs, too, that you have to consider. We have herbs from the United States or the Western world, and we have herbs from the Eastern countries, and those would encompass Chinese herbs and herbs from India and other countries. And it's interesting because even though the plants are different, they many times are very powerful and have different effects on people and can be used for a variety of ailments. So this is an area that can be talked about as well for a long, long time, especially when you get this sort of continental divide in terms of sources of herbal remedies. And many are very powerful. You should, if you decide to use herbal remedies, for most, you should consult with someone who really has a good understanding, because some you aren't supposed to take for long periods of time, and some can, injure the body. They are considered medicines still. They're just not high-end pharmaceutical medicines, and they don't have side effects as quickly or as immediate, but they can do some harm. Now, massage therapy tends to be fairly misunderstood as well. Typically, many people have sort of a sexual kind of thought about massage therapy, and that's not really what massage therapy was meant to be. Therapeutic massage is designed to stimulate through touch the body and get fluids flowing into and out of muscles. We're talking about increasing blood supply, increasing waste removal from muscles, and allowing the body to relax and, again, heal naturally. And massage is great as a stress reliever. It's great as something that would help tone and improve muscles. It's great for the immune system and immune system function. And I recommend that everybody periodically add massage to their whole healthcare regimen and their healthcare team. Very important, very useful. And massage, as is chiropractic, as are herbal therapies, are all useful, we always say, from the womb to the tomb. And from birth to death, all those are useful. There aren't any people who couldn't be candidates for such therapy. You just have to go to someone who's knowledgeable. And every now and then we hear someone say, oh, that therapy wouldn't be beneficial. There's no one who couldn't benefit in some way, shape, or form from using those therapies. You just got to go to someone. Sometimes they have to be adapted, as all things do, based on the circumstance or based on the person. So massage therapy is a touch therapy, and chiropractic is a touch therapy, and there are lots of things that go on with these touch therapies that are hard to pinpoint. One of the fundamental understandings of alternative healthcare providers is that the body has an innate or an inborn ability to heal itself. Alternative practitioners acknowledge the fact that they don't do the healing, that the body heals itself. And it's really important to understand that, because when you go to an alternative therapist, they are looking at stimulating a healing process. They are not doing the healing. Mainstream medicine doesn't necessarily have that viewpoint, and they're still not doing the healing, but the training does not necessarily include sort of a vitalistic kind of point of view. Megavitamins are the next area were very popular, and again, there are megavitamins, there are low-dose vitamins. They all have different uses, and they're powerful, and you just have to be applied the right way at the right time. And many people are using these in record numbers, and you're going to continue to see that trend all the while. Self-help books are another wonderful and great tool. My favorite happens to be Dianetics, which is the modern science of mental health. We actually keep those in the office for patients. And there's a bunch of other folk remedies that are out there and that are available also. There are groups popping up now that are doing energy techniques such as Reiki and Falun Gong, which is a borderline religious but a very good technique. And energy healing is one of the most powerful and more popular things that's coming back now, because it takes the healing and it puts it in the hands of the person, because people want to help themselves heal naturally if it's possible. And we're also starting to see some really interesting sorts of things in terms of whole food types of medicines and eating more healthy. All these fall under the whole sort of view of alternative healthcare and the revolution and the movement that is really going to take over healthcare. It was once said by Thomas Alva Edison that the doctor of the future will use no drugs, only care of the frame and counseling of diet and nutrition. And that's paraphrased, but it's very true. Well, that's going to conclude our talk today and our introduction to alternative healthcare. We just want to take a moment and welcome you to the future. And this event was sponsored by Integrated Healthcare of Montclair and the Cleansing Center. And we hope this exploration of alternative healthcare stimulated your interest and will allow you to lead a healthier and happier life. I'm Dr. Tyran Mincy, and thank you.